Hospitals can be co-governed. They can be deeply in community. They can be, and regardless of who owns them or what payer system they have. I envision a day or dream of a day where we think about our hospitals and our clinics the same way we think about libraries and schools or parks, right? That we have some public ownership over them. So I know there are many clinic systems that are thinking that way too.
Definitely.
But, our healthcare system, really
and it's because of folks like you.
Leading the charge.
Yeah. We have amazing, brilliant people who work here at this organization, who work very, very hard and who believe in health justice too. So it's a honor to be able to come here to this organization and to work alongside all these folks.
Everything with Latinas Contra Cancer, really how they've let that attention strive into bringing more attention to what's going on with our healthcare system, not even just locally, I think even nationally here in the country is very important too as well.
Yeah, we've been able to have many occasions at a national level to be able to bring voice to the issue of racism in healthcare. It happens.
Racism is everywhere.
It happens. To be able to bring voice to the work of justice, and we often use the word health disparity, but I like to use the word injustice because I use the word disparity too, but I like to work.
Disparity is kind of
sometimes it masks what's really happening, and I went through this fellowship when I first started.
Because when you think of someone in despair, somebody who's helpless can't.
Yeah, that's a really good point, because health disparity isn't just a natural occurrence. There's part of the political education we do here around healthcare is to be really clear about who or what is causing the problem. It's not enough just to say, okay, well, you don't have the care that you need.
There's a disparity.
We're going to have the care that you need. It's a disparity, and who knows how it happened. We don't know how. Nobody knows how it happened. But in reality, there's always a reason that it happened. And what I learned over time is that it's always because of public policy that baked that kind of racism or injustice or bias or discrimination in, or an absence of public policy protecting vulnerable people.
I was about to say, it's very much systemic, and it's it very much hurts the people that are in those hospitals at the bottom.
Yeah, individual behavior matters. Absolutely, we want people to maintain healthy lifestyles and to think about their prevention and detection. But when we place too much focus on individual behavior, then we can get into this space of shaming people.
Yeah, because like you said, your regular doctor's appointments, your regular checkup, not everybody has the privilege to take off work to go.
Right. Or let's say you live in a place that is causing a chronic condition because of the environment.
Yeah.
Or let's say you live in a place that there aren't safe spaces to
external
exercise,
factors.
or there's all of these things that you could do everything right. Like my grandmother, she maintained a healthy lifestyle. She didn't really drink too much. She didn't smoke. She maintained her weight. She did all these things.
You could maintain a healthy lifestyle in a glass house.
Well, yeah, and she and many of her comadres had cancer, and may have been the impacts of working in an orchard and a cannery, right? So these are, she did all the things, quote unquote, right. Although I have issue with even what we say is, right or wrong, or these are not binary things.
As in, the things that wouldn't traditionally cause such a disease, but then it still happens.
And still, these things happen because of other factors. The better thing is to think of it collectively, what are we doing to make it more possible for people to achieve health, instead of individually blaming people, especially when we know that politic and public policy plays such a big role in healthcare. Something that I think is important for people to remember is all healthcare is political.